I get mean at the end of the day. I'm sorry, folks. Hello, lovely Kate Breslin from the Schuyler Center.
All right.
Come and testify. Thank you.
Hi there. Thank you. Thank you all for sticking it out. I'm Kate Breslin from the Schuyler Center for Analysis and Advocacy, and with me is our senior policy person, Kari Siddiqui. And because we were just talking about it, and I was going to mention it anyway, I just want to support what Jerry Wallace just said about kinship care. And I think it sometimes gets left out because, as Jerry said, it really is part of what we think of as our child welfare system, but we don't think about it in our child welfare system. And all the problems that Jerry talked about are things that we hear too. And I know that several of you have asked questions during the day about the opiate epidemic and things like that. And I think it would not surprise me if we begin to continue to rely on kinship caregiver arrangements even more in that context. And we just don't know. We don't know what the numbers are. We just know they're big. So I want to just call out that over the last several years, particularly in the areas of funding for programs for children and families, we really haven't seen a lot of attention to those things from the governor, and we're very concerned about it. So our testimony, I won't get into a lot of detail, as I do know I've been here a lot of the day, and I know that they've been touched upon, but I want to support your interest and what I heard from many of our advocate friends around increasing funding for child care for all the reasons, both for parents, for kids, and for economic development. I also want to call out that we've been coordinating a maternal, infant, and early childhood home visiting work group for probably 10 years. And the reason we've been doing that is because the benefits of those programs are very clear. In New York State, we fund them in different ways. We fund them out of different agencies, and so there's always a lot of confusion. So we felt as though there was a reason to bring people together to try and come up with some unity around articulating the benefits and advocating for cohesive funding. So we are, together with many of our friends, advocating for some thought put into where there is need. Many of you asked questions about, to what extent do those programs meet demand? Not at all. We worked with the Council on Children and Families and developed some great maps that kind of show need and then capacity, and it's pretty clear that there are some pockets in the state that have great home visiting programs, and then huge swaths of the state that really don't have any. And we know that they have benefits. They've been proven over years. In child welfare, it's a massive system, and it's really complicated. And I know that people have touched on parts of it today. We're one of the folks. We're one of the folks who come here not asking for funding for our agencies. We're a nonprofit organization that is funded with private philanthropic dollars. We think that we need to pay attention to preventive services. So New York does invest in what we call preventive services. However, those are only available once a case is opened. So when we had a convening that brought together families and parents, young people, and service providers, they called that, at that point, you're at 5 minutes to foster care. So once you are able to access those preventive dollars, those so-called preventive dollars, you're kind of already, tipping and on the way in. So we are advocating that we as a state should, two things. We should be investing in real prevention, in community-based prevention that can be used before cases are opened, and also a closer look at the effectiveness of how the preventive dollars are spent. We have no idea. So we do know that foster care numbers have gone down in the last decade or more. We do know that we have preventive programs. We have zero measurement in New York about whether those preventive dollars are doing anything. I'm not suggesting that they're not. We don't know. We want to support the addition of the $1.5 million that you all put in to get young people in foster care or who had been in foster care to go to college. And that's been, from what we have heard, it's been a success. And we urge you to add to that. The governor put money in this year, which is great. We urge you to increase that funding to support kids going to college. We also want to call out the importance of, there's a housing subsidy for young people in care or who have aged out from foster care. You won't see this in our testimony simply because we neglected to put it in, but we urge you to increase the housing subsidy. We had hoped to kind of grab onto all the excitement about housing in the rest of the budget, and we are very appreciative. We know Assemblyman Hevesy is supportive of this, but we think it's important. The subsidy right now is $300 throughout the state, and a young person essentially can't have a roommate and has to prove that that $300 will stabilize their housing. So we need to increase it. And just as a side note, 1,300 young people age out of care every year. And so when we're talking, and we know that many of them are likely to, we have some statistics nationally in the state that many of them are likely to become homeless, either officially homeless or couch surfing. So there's great reasons to put some more money into that. Let's see. We talked about kinship care, so I will skip our piece on that. And then we support raising the age again this year. And then finally, at the end of our testimony, we look at issues relating to family economic security. While those may not be in the OCFS or OTDA budgets, many of the programs and services upon which families rely, especially at-risk families, they rely on them because they're living in poverty. And they wouldn't be at risk of being in the child welfare system or in any of these systems if they had economic stability. So that's why you'll see that we call attention to the importance of raising the minimum wage and funding it for human services, of paid family leave, and of an increase in the earned income tax credit for low-income families.
Thank you.
Thank you. Any senator questions? Assembly questions? I just have one. So you talked about that the money for post-foster care rental assistance is only $300 a month, and they can't have a roommate. Why would we have a rule like that? It doesn't officially say they can't have a roommate, but it's so it's administratively burdensome if you do have a roommate. So there are efforts underway to try and streamline that, and it would take a change in statute. So I mean, the $300 amount is absurd to start with, but and then the strings it, so it's both. Yes. Yes. But then to actually say, so you've aged out of foster care, you've got nobody else out there in the world, and guess what? Don't you dare find somebody to help you with
to share rent with
and housing.
And you're right.
So that was like, some strange devil wrote that statute. We should look into that also.
Somebody from the 1940s.
Well, wait, you've been here since the 1870s. I remember. We went down this road, didn't we? I'm sorry. We're a little, we spent too much time together in this room. Thank you very much, both of you, for your testimony. And our next testifier, and I see her there, Susan Antos from the Empire Justice Center. And for those tracking, followed by Advocates for Children, Randy Levine, followed by Center for Children's Initiatives, Betty Holcomb. Hello, Susan.
Good evening.
Evening.
Thank you for staying, and thank you for your interest in these very, very important issues. The work you do is so important to us. Thank you so much. Since it's late in the day and my remarks are in writing, I'm just going to highlight a few points that are in our testimony. As you know, the Empire Justice Center is a multi-issue organization, and on page 2 of our testimony, we list the 7 areas that are in our testimony, including increase in funding for managed care consumer assistance program, continued investment in the disability advocacy program, expanded categorical eligibility of SNAP benefits, which the governor has recommended and we support, increased fuel and shelter allowances, elimination of asset tests, and 2 child care items. I am only going to talk about the last 4 items. I don't believe, although I didn't listen to everyone, but I don't believe that anyone has spoken about the fuel and shelter allowances, and I think that's an important piece of the homelessness puzzle. We are thrilled with the homelessness initiatives that people are talking about, and we're glad that there is this interest and increased investment in homelessness. But we can't be sheltering people on one side and pushing them off the cliff on the other. And that's what's happening in the public assistance system. On page 6 of our testimony, there's a box highlighted in green about a woman who came to our office a short time ago. She's 58 years old, and she has an apartment that costs $575 a month, a bargain, right? Except she's a single individual, and that shelter allowance for a single individual in Albany County is under, well, if you're a family of 3, it's $309. I believe it's about $190 if you're a single individual. So with her living allowance, her total shelter allowance and living allowance does not even total what her rent is. So her landlord for a while let her stay because she kept looking for work. She'd find a job. She had a very difficult time. And she's facing eviction. She's going to be in a shelter soon, I'm sure, because the total of her grant, living and shelter allowance, was only $425 a month. The shelter allowance for a family of 3 in New York City is $400 a month. So as you're sheltering people on one side, when a family's in crisis, giving them $400 to pay for rent in New York City is not going to find them a house. I think you all know that. The upstate, the family of 3 in Albany is $309. In Erie County, it's $301. It's really between $300 and $400 just about in every county of the state. So we have a proposal. We've written a report called Turn Off the Heat, and some of that, it's available on our website. What we are proposing is that we use the fair market rent as a standard by which to set our shelter allowance. We have a modest request that right now shelter allowances be set at 50% of the fair market rent. Right now, you can see that the one bedroom fair market rent rates are much lower. So we'd like you to consider that, and as well as an increase in the fuel allowance. Part of the public assistance grant for people who pay for their own heat is an allowance to pay for fuel. It varies depending on whether or not you pay for electric or whether or not you pay for your heat by oil. But our recommendation is that these allowances be raised. They have not been raised since 1987. And so what I wanted to, so that's over 30 years ago. And since that time, the cost of heating oil, even though it's come down, since 1987, the cost of heating oil is 4 times what it was in 1987, and the cost of natural gas is double what it was in 1987. So families who pay for their own utilities, for their own heat, and outside of New York City, that's a substantial number of people, are really squeezed by a very inadequate shelter allowance. We believe that the low shelter allowance and the cost of fuel, the low rental allowance are pushing people into homelessness. Our other recommendation has to do with the asset test. Another recommendation, we're in a minority of states now that have a very low asset limit for automobiles. If in fact we are what we say we are, which is a temporary assistance program, we need to do everything we can to make sure that families that need to rely on public assistance can get out and can get to work. And one way they can do that is with a reliable car. There are only 11 other states in the country that do not exempt a car totally. And we need to be in the forefront in this area. Additionally, our rental allowance discriminates against people with disabilities because we have a higher resource level for people who are able to work and a lower resource level for people who are not able to work. Finally, and I know I'm out of time here, I'm just going to walk you through. I know you've had a lot of people testify about childcare today. We join everyone with the ask for $190 million. I want to let you know what resources are in our testimony for you. If you want a detailed explanation of what's required by the federal law, if you start on page 12 of our testimony, we've given you a breakdown including all of the federal and statutory and regulatory citations, including the citations to the New York State plan to the federal government, which explain in detail the new requirement for a 12-month eligibility period, regardless of income, unless the income goes over 85% of state median income, the requirement for a graduated phase-out of child care subsidy assistance as long as the family is under 85% of state median income, a requirement that child care subsidies be portable across counties. This is huge for us upstate. We're so glad to see it, but there needs to be money to pay for it. We're also thrilled that there's a greater emphasis on serving homeless families. Under the plan, the draft plan that OCFS proposes to file with the feds, there is a priority given to homeless families, which we're thrilled about, but that means that we need to protect low-income working families as well who have subsidies. So we're not taking subsidies from low-income working families to pay for subsidies to homeless families. The federal law also requires that absences be paid for, just like those of us who have paid for child care had to pay for absences. They'll be on a footing with other people in the private marketplace. There are provisions for fluctuations in earning. There are priorities for special needs children. And just to add into the mix, our market rate is up for readjustment in June. We want to keep it at a rate that keeps providers whole, not see providers lose money to pay for these federally mandated changes that don't come with a lot of money behind them. So I hope you find this a resource. I'm happy to answer any questions. Thank you for hanging in. I know it's been a long day.
Thank you.
Thank you very much, Susan. I believe we have a question from Councilmember Hennessy.
I will go quick, but first, Susan, hi.
Hi.
And thank you to and Kristen for all of your work. And I think my guys reached out to you. I actually need you tomorrow, so thank you. Okay. So I just want to drill down on one thing, the shelter allowance. Okay. So once we get a sense of an issue, we can be relatively aggressive, and that's what we're here to do. The shelter allowance, we've sort of not been aggressive about because I may be under some false impression, but maybe you can help it with me. It's my understanding that there's a legal case against the state regarding the shelter allowance right now because it hasn't been raised since 1987, and that case was brought, what, like a month ago or two? Is that right?
I believe it's just in New York City.
Oh, okay.
And it only involves families with children. Because there's a statute that says that the shelter allowance has to be adequate to allow children to remain in their homes. And so that's why people like Ms. V, who's in our testimony, have a much lower shelter allowance. Because when the first shelter allowance case, which was called Jiggets, was litigated and settled, that applied to families with children. Those shelter allowances went up. The shelter allowances for singles stayed much lower. That's why it's virtually impossible for a single individual to find a place to live on the current shelter allowance.
Right. So I agree with you that the shelter allowance or FEPS or any rental subsidy should be somewhere close to the federal market fair market rate. That's the only logical way to do it. So I agree with your proposal. The reason that I have not been advocating or going full force for the shelter allowance at this point is because my understanding is if you introduce a bill or go after it budgetarily while there's litigation, the judge can actually, if that doesn't pass, if your bill doesn't pass or your budget ask doesn't pass, the judge in the case can actually say, no, we're not going to rule on this because the legislature didn't pass it, and therefore it's out of the jurisdiction of the courts. It only goes back to the legislature. So part of the hesitation for me is the legality of it. I don't want to go for it, possibly not get it, and then screw up a court case. Does that make sense?
Well, let me talk to my colleagues in New York City.
Okay, please, because otherwise, to be honest with you, I agree. The shelter allowance, 1987, it's ridiculous. And we would go after it wholeheartedly. I'm just afraid going after it and losing affects not only losing in the legislative and executive branch, but will cause a loss in the judicial branch as well, and I don't want that. So if you could let me know.
I will.
I
I'll
could
talk
be
to my
completely
colleagues and
misinformed.
get back to you.
Thank you very much.
Thank you. Also, I just want, Susan, before you get up, I want to also thank you from the
Okay.
Empire Justice Center for everything you do, and the testimony is extremely detailed and complete. One thing that you, I think, didn't have a chance to go over, but it ties into earlier testimony, and I was actually speaking to the chair when someone else was testifying. So we are making people put their children in infant care slots so they can go work somewhere that pays them far less than $14,000 a year and are paying $14,000 a year for an infant care slot, or you had charts actually showing the range. I mean, that's crazy in its own perspective, but your point that you didn't have a chance to make tonight, but I just wanted to highlight for us, if we stopped mandating that women on public assistance leave their children in infant care slots, which government pays for, to the tune of $10,000 to $14,000 a year, to seek out work experience or jobs that don't even pay them what we're paying for child care slots, they could stay home providing better care for their infants. And as you point out in your testimony, we could turn that money into up to 3 times as many subsidized slots for older children for working mothers. So I think that is such a critical sort of tie-in for this legislative body to grasp. So I wanted to highlight that.
Thank you for raising that. That is the last section of our testimony, and we do have detailed charts calculating the savings so that for each infant slot that's freed up, over 3 slots are freed up for a working family, because remember, families on public assistance don't have a copayment. Working families actually do have a copayment, so the cost of their slot is less.
Thank you.
Thank you.
And as the chair returns, our next testifier is Advocates for Children, Randy Levine.
Good afternoon.
Welcome.
I think I'm last. Betty Holcomb is not here. You've added some. Okay.
There are actually,
All right.
right, there are 3 remaining people.
Okay. Thank you for the opportunity to speak with you today. My name is Randy Levine, and I'm the Policy Coordinator at Advocates for Children of New York. For more than 40 years, Advocates for Children has worked to promote access to the best education New York can provide for all students, especially students from low-income backgrounds. Every year, we help thousands of New York parents navigate the education system, and we use our on-the-ground experience to identify barriers to education and to work to pursue systemic change. We support increased funding for several of the programs that have been mentioned throughout the day, including home visiting programs, but I want to focus today on childcare. As an education advocacy organization, we know that the first 5 years of children's lives have a profound impact on their education and future. Long-term research shows that children from low-income backgrounds who are left out of high-quality early childhood education programs are more likely to be retained a grade, to be placed in special education classes, and to drop out of school, than children who have access to such programs. And leading economists have found substantial savings by participating in early childhood education programs. For many families with low incomes, subsidized childcare provides the only opportunity to access early childhood education for their children. And of course, it also helps families to work. However, due to limited funding, only 22% of income-eligible children have access to subsidized childcare in New York State. As you've heard today, the recent reauthorization of the federal child care law, the Child Care and Development Block Grant, or CCDBG, brings significant opportunities as well as significant challenges. We're pleased with a lot of the changes in the law. However, we understand that these changes have substantial financial costs. Unfortunately, the executive budget includes a mere $10 million in additional funding for childcare. This funding falls far short of the investment we need to prevent children from losing access to subsidized childcare. And that's why we're joining with the many others who have spoken today in calling on the legislature to increase childcare funding by at least $190 million. As you've heard, the state has estimated that it will cost $90 million to implement only the health and safety new requirements of the law, the inspections, the background checks, the training on health and safety. Additional funding is needed because the market rate will take effect, the new market rate will take effect based on the state's market survey in June 2016. And we want to ensure that child care providers are paid an adequate rate. We also want to note that in its draft child care plan, OCFS mentioned that it is assessing the market rate that it pays for children with special needs. And we think that this is an important area to address as well to make sure that child care providers can serve all children, regardless of ability and disability. And Susan Antos mentioned a number of the other changes that are being made because of requirements in the federal law. I'll just highlight one. The federal law has several new provisions aimed at providing increased access to children who are homeless. Currently in New York State, children who are homeless are eligible for subsidized childcare only if their parents fall into an existing category of eligibility, such as receiving public assistance or meeting certain work and income requirements. We have received calls from families who are experiencing homeless and are desperate for childcare for their young children, but do not meet the current eligibility criteria. We are very pleased that the draft childcare plan released by OCFS included the state's intent to make children who are homeless categorically eligible for childcare, in line with the new federal priority in serving children who are homeless. This change would have a significant impact on the lives of young children experiencing homelessness. Childcare is critical for these children. It provides them with a safe, developmentally appropriate place to learn and prepare for kindergarten, and allows their parents to be able to look for housing and jobs. Furthermore, a disproportionate number of children who are homeless experience delays in their development. Connecting these children to high-quality childcare programs not only helps them prepare for kindergarten, but allows educators to monitor their development and connect them with services when appropriate. But we must ensure that there is adequate funding for children who are homeless to access childcare subsidies, along with making these additional required changes. Therefore, we are asking legislators to invest at least $190 million in new funding for childcare. Given the significant unmet need that already exists, we want to ensure that the state does not fund these new requirements by decreasing the number of children who have access to childcare. Rather, we need new funding. We look forward to working with you as the budget season progresses. Thank you for the opportunity to testify, and I'd be happy to answer any questions that you have.
Thank you. Any Assembly, any Senate?
Thank you.
Thank you very much for your testimony. It's not lack of interest, it's the time. And our next testifier, Betty Holcomb, Center for Children's Initiatives. And there was no testimony submitted, so it's possible she wasn't here? Correct, she wasn't here. So, and then we had one additional cancellation. So I believe our next and last testifier is Melanie Lowy, I'm probably just reading it completely wrong, Chief Operating Officer, Stop Abuse Campaign. Low? Well, you're going to come right here and you're going to tell me your name because I've done it wrong.
Nope, it's Blow. It's very logical and it confuses people all the time, so take no offense. Thank you so much for hearing me today. My name is Melanie Blow. I'm the COO for Stop Abuse Campaign. We protect children by preventing trauma, particularly life-altering traumas such as child abuse, neglect, and maltreatment. Everybody knows that child abuse is bad. The Centers for the Disease Control conducted the Adverse Childhood Experience Study in the 90s, which proved that it was a lot worse than we thought it was. It proved that any and all child abuse, neglect, and maltreatment harms a child for their entire life. We had known for a long time that abused, neglected, maltreated children were more likely to be criminals, suffer mental illness, suffer drug addiction. We didn't realize that they are also more likely to die from cancer, heart disease, diabetes, things like that. Which means prevention is absolutely, positively the most important thing. And I completely, introducing myself, completely forgot to start off our ask, one and only ask, which is that you kindly invest at least $4.5 million new dollars in maternal home visiting throughout the state. Okay, so adverse childhood experiences harm children for the rest of their life. Flint, Michigan did something similar that everybody in this room has heard about. They made a decision that very predictably was going to expose children to lead. Lead functions very much like an adverse childhood experience. Lead causes short-term physical harm to children, long-term physical harm to children, cognitive issues to children, educational disabilities to children, and makes them more likely to be arrested as adults. So do adverse childhood experiences. With Flint, there was the word poisoning, so people got very excited about that and realized, hey, somebody's purposely doing something bad to children. We've got to stop that. When we don't invest in maternal home visiting, we've actually harmed many more children than Flint has in 20 years by not investing in these programs the way we need to invest in them. But that's considered business as usual. We always say we can't afford to invest in maternal home visiting. We don't like spending money on CPS, but we do it. CPS costs more. We don't like spending money on special education, but we do it. That costs more. Right now, something I've heard us talk about quite a bit today, we don't like spending money on treating opiate addiction right now. That costs a lot more. All of those things are preventable by maternal home visiting. It costs about $1 million to investigate a murder in New York State. There are about 250 children who die directly from abuse, neglect, or maltreatment. $250 million would enroll about 81,000 children in one of the average price maternal home visiting services. That would not quite provide universal access, but it would come awfully close. And this is money we already spend. In October, I went to the funeral for Vernela LaVenture, who was a 4-month-old baby beaten to death by her mother. They had to bury her with this little white cap that masked how her skull was broken. Her mother was desperate. We know how to keep mothers from being desperate, and maternal home visiting services do that. In January, I met with a bunch of women who were enrolled in one of the programs. One of them told me about how her baby was born with serious complications. This woman is an abuse survivor. She was a recovering drug addict. She didn't know what to do. This was her first baby. She had no idea how to parent him. One of the home visitors told her, read to him. So she did. She read to him in the NICU. 3 other babies were born with similar complications in the NICU that day. Hers is the only one who lived. And this is, to me, those 2 stories represent the choice New York is at right now. We can invest in preventing abuse. We can invest in mopping up its consequences. Preventing it is a lot cheaper, it yields much better results, and it's the compassionate thing to do. Like I said, that's why we're asking for an investment of at least $4.5 million new dollars in maternal home visiting, which has been flat funded for the last decade. Thank you very much. 9 seconds.
Any questions?
Thank you.
No questions? Well, thank you so much for participating today, and we certainly appreciate everyone who took the time to educate us about the impact of the executive budget on human services. So that concludes our hearing, and there's just one more that needs to be set up regarding the MTA. But other than that, we have achieved a lot of the work through the hearing process. So I want to thank all of my colleagues for their patience, for their hard work and participation, and look forward to continuing onward through the state budget process for this year. Thank you.
Thank you.
Thank you.